What's up, guys? Very good morning. It's 5:45 a.m. in Bangladesh, and today is 23rd September. So this is just gonna be another vlog for my study. In fact, this is another video from Sam the Pharmacist. So, in contrast with the last two videos, I was going through the Angina Pectoris issues. So there was two classes like Angina Pectoris 1, which covered the definition and classification and everything, and the second class was basically based on the classification. So the first class was there so far I can see from here it was stable angina in the second class. So in fact this is gonna be the third class for angina pectoris. So in this class I just want to discuss about the unstable angina. As we have discussed, there are four types: stable one, the unstable one, then the third one is nocturnal angina, and fourth one is presmental or variant angina. So let's get into this second part, the unstable angina. So I have just written a couple of things in my Notion app, and just a summary of the book, which is called Comprehensive Pharmacy Review. That's a book from Leon Scherzel, and this is basically a preferred book for passing different kinds of exam, like the evaluating exam for PEPC and many other exams also. So let's get back into the topic. So if we talk about the unstable angina, I would like to address 5 points here. So number one is that unstable angina episode will be of low threshold. So what does that means? That unstable angina will be of low threshold. It means that if the patient is having unstable angina, the threshold for initiating this kind of episodes, like earlier we have discussed, basically exercise or emotional stress, these are the factors that actually governs the episodes or the initiation or the onset of angina in many cases. So in that cases, if a patient suffers from anginal discomfort after climbing up 2 floors by stairs, so in that case we can consider that the threshold is stair 2 or level 2. But if we see that the same patient is having the same amount of discomfort, anginal discomfort, just after moving up to level 1, so that means the threshold is much more lowered. So earlier the patient was supposed to get the discomfort after having lots of exercise. Now the same patient is having the same amount of anginal discomfort after completing only a small amount of exercise. So that means the anginal episode will be of low threshold. So number two is that it is more frequent. Obviously the stable angina and unstable angina, the big difference is frequency. So it is more frequent than that of stable angina, because in some cases stable angina is predictable. If I am a patient of angina, I know when this will happen, because it is mostly related with the exercise as well as emotional stress. So if I feel that right now I'm doing exercise, so I can predict that there is a chance I will start getting that pain or discomfort. But in case of unstable angina, it is more frequent than that of stable angina, and it is of longer duration. This is the toughest part of this game. In case of stable angina, it was very shorter, like within minutes it will be resolved by taking rest or by taking nitroglycerin. But in case of unstable angina, it lasts very longer, like sometimes it is lasting more than 20 minutes even. The fourth one, this is my abscess. The fourth one is decreased response to rest or nitroglycerin. So basically, for treating the stable angina, we have seen the patients are supposed to take rest or nitroglycerin or both. In this case, what we will see that the patient is having reduced response to rest as well as nitroglycerin. So it means, say for example, the patient is having anginal discomfort, so you have started taking rest. So obviously it is supposed to relieve the discomfort. Right now you will see that at the beginning it was quite working, but now it's not working that much. So it means even after taking rest, it is not being resolved. Even in case of nitroglycerin, you will see the nitroglycerin will start losing its response. Like earlier nitroglycerin used to work, now it's not gonna work, or even it is working in very negligible cases. Not in every cases we will get the relief from anginal discomfort using nitroglycerin. So the summary is that decreased response to rest or nitroglycerin. So let's come back to number 5. So number 5, it says unstable angina. This is actually a serious prediction of higher short-term risk, which is progressive. So obviously, uh, if the angina is stable, it is quite okay. But if the angina is unstable, that means you need medical attention, and something is happening beyond your, beyond your eye. I mean, this is kind of a risky situation. Short-term risk is there, and the disease is progressive. Obviously, the coronary circulation is being deprived, and that thing is getting worsened day by day. So this is becoming the signal for the incipient MI. So obviously this is an important signal that the patient may have an attack, myocardial infarction will be there. I mean heart attack we used to call it. So obviously this is a important sign which is need to be addressed to the physician. And altogether this what we call is ACS, acute coronary syndrome. So as we have discussed, unstable angina, this kind of a symptom or a signal for an MI, upcoming MI, just kind of an alarm for the MI. And grossly we call it ACS, and this episode obviously need to be addressed to the physician immediately, because if it is unstable, then you have nothing to do here. The medications like the nitroglycerin is not working, the rest is not working. So what you can do, you can just consult with the doctor immediately, because as we have said, this is a signal or a sign of an upcoming MI. So this was all about unstable angina. I think in the next class I will come up with the nocturnal angina or angina docubitus. So hope for the best and good luck. And if you just want to know what are the other classes, you can just check the other videos of my channel. Like as I have discussed, already 2 videos have been uploaded regarding the angina pectoris. Angina pectoris 1 and 2, that covers the definition, classification as well as stable angina, and this class was for unstable angina. And you will also find many other chapters I can show you from there. This is my channel over there, and I have started uploading videos. This is not basically for anything, just to vlogging my things. I mean, just to vlog the things that I'm studying right now. So you can come into that channel and have some benefits also. So I think it's enough for today. So good luck, see you in the next video.